Welcome back to On the Beat, everyone. I'm over here with Dr. Bethany from the Dermatology Clinic, and we're talking all things not only natural beauty, but of course cosmetic as well. Welcome to the show, my friend. Okay, now let's talk a little bit about how does one enhance their own natural beauty at home?
Well, as a dermatologist, I try to get people to take as good a care of their skin as they can, because when the skin is well taken care of, it will be more beautiful. And whether that's with skincare regimens at home or with aesthetic procedures that we offer at the clinic.
Of course. Now, do you remember back in the day, you would have heard your mother or your grandmother say, wash your face with a good sunlight soap. How life has changed.
We've come a long way, Troy. Yeah, and interestingly, you know, I think I'm seeing trends in dermatology change as well. I've been in the business for 20 years, and in the past, we've talked a lot about rejuvenation. People have sun damage, they're beginning to see signs of aging, and they want to rejuvenate. But in the last few years, I've really noticed the millennial generation, you know, people between the ages of 20 and 40, they don't necessarily need to rejuvenate, they want to avoid that altogether. This group of people wants to prejuvenate. They want to prevent. Prevent the signs of aging. And so, again, the millennials are savvy in their social media, they're educated, they know that there's tools out there to keep their skin beautiful, and they're interested.
Okay, all right, well, let's talk a little bit about cosmetic. What's your typical cosmetic patient look like?
Again, we treat people who are interested in rejuvenating, prejuvenating. Our most popular cosmetic procedure at the clinic last year was Botox cosmetic.
Of course. I've been having it for 30 years. That's why I'm only 82.
Right.
And I think with that Botox as well, it's a great preventative.
Absolutely. Well, again, we treat people with different doses of Botox depending on their age. Last year at the clinic, we did over 700 Botox treatments. It's very popular.
And there's so many uses for Botox as well. We could do a whole show just on Botox, but I did notice that you've bought some other amazing skincare products in. Just talk us through what are some of your favorite.
Well, Troy, I think the right answer for a dermatologist is sunscreen. Of course, you know, that's the right answer. But I don't think there's one product that's perfect for everyone's skin. And so if a person comes to the clinic and asks me, what's the best product for me? I like to ask them, what are your goals? What are you trying to achieve? And then we would customize a program for them.
Okay, so let's talk about that at-home skincare routine. What do you normally tell your patients to be doing on a daily basis?
Yeah, well, obviously cleansing morning and evening. And depending on their goals, I really like antioxidant products in the morning. Protects against environmental and UV damage. Sunscreen in a sunny climate is essential. And in the evening, I really like the Retin-A or retinol products to rejuvenate.
Now, when we say that Retin-A or retinol, it has had a bit of a bad rap back in the day. Why is it so prevalent to today's?
Well, you know, I think if retinol or Retin-A is not used appropriately, it can be overly irritating. And so that's what people have as their experience. When we create a customized regimen, we educate people on how to use it. I will often blend it with a moisture formula to make it more tolerable. So it really has to be customized for a person for it to work well.
Different type of customization. What can a guy, if one of the women is sitting at home and says, my husband or my son needs a skincare routine, do they use these type of products as well?
Absolutely.
Really?
Yeah, they can use all of these products as well and achieve great results. All
right, well, we appreciate yet again coming in. There's so much to talk about. If you want to find out more information about Dr. Bethany and the Dermatology Clinic, there it all is up on your screen, everyone. And we'll be right back after this short break. You're watching On the Beat.